Good morning.
Good morning.
Thank you, David. My special guests, ladies and gentlemen, and of course all the folks online, welcome. And welcome Alice and Mark. I guess you would say, we're at it again, right? It is your exceptional leadership as commissioners, as co-chairs of this commission, that has really caused us to want to take a second look. And we couldn't ask for better guidance as you've given us in the past, and I know will give us in the future. And of course, David, we thank you for your tremendous expertise and the commitment that you've provided throughout this entire effort. All of the commission has done an extraordinary job in carrying the messages of the first commission to meeting rooms, to living rooms, to meeting halls all across America. And they've worked hard to make sure that the recommendations stayed high on the public agenda. And as you'll hear, the commission has had a real effect on action all across the country. So to all of the commissioners who are returning to work on these important issues, all I can say is welcome back, including Sheila. And to those of you who are new to the commission, let me just say welcome aboard. You know, I love the message that was delivered in the video because it presents the work that the commission has in a simple, straightforward way. Give people the opportunity to lead healthy lives from their very first days to their last, from cradle to twilight. It's that simple, that important, and that difficult. It's one of the most significant accomplishments that the first commission achieved was getting people to understand that health is more than medical care and health care. It's simple, it's important, and it's difficult. It's simple because we know that health is affected by where we live and how we live, where we learn, where we play, and where we work. It's important because we know that the research shows that these daily occurrences are significant and widespread. It's difficult because most policy discussions, even now, still focus narrowly on medical care. And by the way, for those of you who don't know, that phrase, where we live, learn, work, and play, actually was developed by the first commission, and now you hear it everywhere. It's ubiquitous. It's a simple concept, but it's also a difficult one because it means that there is not one easy fix for this nationwide problem that we face. Our neighborhoods, our schools, our streets, our stores, our jobs, the communities in which we live, all play a role in the state of our nation's health. And everybody, our families, our teachers and caregivers, leaders of business, community, government, they all have to work together to make things better. And we know that that is not simple. In fact, it's really difficult. Now, 4 years ago, when the commission issued its recommendations, it sharpened our nation's focus on the social determinants of health. And happily, they sparked a discussion all across America, but they've also created action in towns and cities, in school lunchrooms and on playgrounds, in community centers and health clinics, municipal halls, and in workplaces all across America. Now, in a moment, David is going to discuss the progress that's been made by the Commission's 2009 recommendations in much greater detail. But what I'd like to do now is share an example that speaks directly to where we are today and the discussion that we're going to have in just a few minutes. Early childhood intervention and community development. In Minneapolis, there's a program called Northside Achievement Zone, and it's taking what's called a cradle to career approach to helping low-income families use education as a ladder out of poverty. One of our speakers today, Art Rolnick, is on the board. And Art, I'm really looking forward to your remarks. People call this program NAZ in Minneapolis. It's a program that the CEO describes as one that's trying to change everything about the kids in Northside at one time. Sonia Samuels, the CEO, says they are trying to provide a cocoon of support. It's a cocoon that surprisingly speaks directly to what this commission has recommended for all children, that they receive high-quality care, coordinated services, and early education. Now, each family in the NAZ zone has a personal coach. And this personal coach provides a team of public and private partners who address the full needs of the children, what they need to succeed inside and outside of the classroom, pre-K right through college and beyond. So if the family needs housing, the coach provides a decent place to live. If the issue is food, the coach helps the family find groceries. If it's work, the NAZ coach strives to find not just a job, but training for a career. Northside is really not just patching together holes temporarily in a family's life, but they're trying to infuse the entire community with the expectation that they will succeed. And when one family succeeds and shows that it can be done, another will join the effort. And so family by family, they create a culture of success that is truly inspiring. It's a really great start. And right now, NAZ is providing care and working with about 600 families. But there are 3,000 in Northside. And how many hundreds of thousands all across the country need the kind of support that NAZ is providing? The good news is that we know what works. We know that giving children and their families a healthy start and early childhood development programs, and we know that if we can help them build healthy communities that provide opportunity to make the healthy choices, we can make a difference. Now, last month, I met an inspiring group of people at a Southern California city called Rancho Cucamonga. Heard of it? Ever been there? A couple of people, okay. Well, I hadn't until last month, but 5 years ago, the city council there decided that they wanted to seriously promote sustainability as part of their future direction. And as a part of that, they included healthy living. And what they discovered was that the community was hungry for health initiatives that actually brought healthy choices to their community. Things like city ordinances that turned farmers markets into places where you could have healthy food, not just the kinds of things that are usually sold at flea markets. And that they wanted cooking class to learn how to use that fresh food that they bought at the food markets. The residents said they wanted to establish a way that they could get more affordable food. So the city council brought in food vouchers that allowed them to buy twice as much at the farmers markets with their food stamps than they otherwise could have. Now today, those programs are touching on primary care, on education, and on planning the city's infrastructure. They've become so popular that Rancho Cucamonga describes itself as Healthy RC. That's its brand, Healthy RC. And residents who never thought that they could be a part of shaping the public policy now have become very sophisticated community leaders, understanding how to use things like zoning and regulation to bring healthy choices to their communities. So commissioners, it's stories like these that provide the reason that we think it's so important for your new recommendations to guide not just a few cities, but every city all across the nation to understand how to be healthier. Now, commissioners, I'd like to ask you to do one more thing. As you listen to the experts today and as you weigh the data and make your deliberations, I want you to consider the question of equity and the root causes of violence. 47 years ago, Martin Luther King said, of all the inequalities, injustice in health is the most shocking and most inhumane. That's personal for me because I was a child when those words were spoken, and now I'm a grandmother, and yet the disparities linger. The issues of inclusion and equity are not simply moral questions. They're a matter of economics, and economics that affect each and every one of us. As the Nobel laureate Joseph Stiglitz has said, the magnitude and nature of our country's inequality represents a serious problem for America. Alleviating it and promoting growth are intertwined and complementary goals. Now, one way that we can measure the extent of the imbalance is to measure the Gini Coefficient. I don't have to tell the economists here what the Gini Coefficient is, but in a nutshell, it's a statistic that aggregates the rift between people's incomes. And what it's shown is that over the last 30 years, America's inequalities have increased by 30%. Now, there are many reasons for this, of course, but we know for certain that early childhood experiences have a powerful impact on a person's ability to succeed later in life. The first commission stressed that America will never be a healthy nation until all of our children have quality education at the youngest age. So we still face a time when too many don't attend preschool, too many still live in neighborhoods where there's no safe place to play, where too many cope daily with the stresses of violence in their families, on their streets, and in their schools. Education, particularly early education, safety, economic opportunity, are the ingredients in this complex recipe that we have for healthy communities. One more story. In Los Angeles, there's an organization called Homeboys Industry. It provides job training and entrepreneurial opportunities for young men and women who were formerly gang members. And they've got a motto. They have it on all their t-shirts. It says, "Nothing stops a bullet like a job." And I would add, a job with a future. They're all connected. They know it. You know it. We all know it. So when you think about introducing grocery stores into an urban desert, we know that it provides healthy food, of course, but it also provides jobs, tax revenues, and community cohesion. We know that when we open a neighborhood health clinic, it increases access to dependable care, of course, but it also provides local residents with safe and trusted places where they can get help and careers, opportunities for jobs. If you provide that cocoon of support for a child as early as possible, you know that you can prevent serious health problems and point her towards a lifetime of greater academic and economic achievement. So the power of the First Commission's report was that instead of shying away from these most difficult and daunting challenges, they confronted them with practical, actionable recommendations. And commissioners, we need you to take that approach again. We have to empower people to lead healthy lives from the start. We have to figure out how to remove the obstacles that keep them from flourishing. It's that simple, that difficult, and that important for our nation's future. The 2009 Commission report called all of us to nurture a culture of health. And at the Robert Wood Johnson Foundation, we've set out to catalyze that by making it the crux of our vision for the future, our North Star, if you will. So what would a culture of health look like? Well, we believe that it would be an America where all people live longer and healthier lives, regardless of their ethnic, geographic, racial, or socioeconomic circumstances. An America where being healthy and staying healthy is a core social value. And a nation where the health of our population, our entire population, guides the public and private decision-making. And where business and government and work leaders all come together in a concerted effort to build healthy communities. So I want to thank the Commission for helping us set our compass on this critical goal. and for agreeing to build on the improvements that we've already seen and to help us hasten the transformation when we can have a healthier nation. So, Commissioners, it's your job to give voice and visibility to these critical issues and to create the zeal and the drive that will help us get the job done sooner rather than later, because we don't have a lot of time. It's that simple, it's that difficult, and I want you to remember that what you accomplish will help not only generations today, but generations for years to come. I don't think there's anything, frankly, that could be more important. So before I sit down, let me just leave you with one final quote from Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, nothing ever has. We eagerly await your recommendations. Thank you.